Hey, welcome back to 5 Minute Sickle Cell Lessons. My name is Marissa Kors. I am your fifth generation sickle cell patient, advocate, activist, and educator. And very quickly, before I hop in the tub, although I said that the last video, I just want to talk about Tylenol and the fact that this war on opioids has really proven to be incredibly dangerous, not only for chronic patients in general, but sickle cell patients specifically. And the reason for this, in part, is that we are down 2 organs generally by the time we're 30. We don't have a spleen and we don't have a gallbladder. Our spleen is generally either shriveled up and basically disappeared, or it becomes engorged and many times has to be removed. And our gallbladder develops gallstones, and whereas the gallbladder itself is not problematic, the gallstones that develop cause infection, and we do not want that infection to get anywhere near um, our gastrointestinal tract, because that's havoc you ain't even ready for. So those 2 organs play a large role in our in the body's filtration system. So the spleen filters your blood, the gallbladder filters, out like greasy things, foods, fats, things of that nature. So with both of them out, our body's filtration system is really just our kidneys and our liver. And as we all know, both Tylenol and ibuprofen, if taken in large quantities for long periods of time, can prove to be detrimental and deadly to both of those organs. So now that we are being forced to deal with this ongoing supposed opioid epidemic, in which, P.S. and by the way, sickle cell patients have been exempt from the opioid shenanigans, just like cancer, since 2016. So the same way that cancer is exempt from the opioid guidelines and ridiculous protocols and caps and all that madness, sickle cell is too. And I really wish you doctors and administrators would actually take a look at that, download the paperwork from the CDC, read it, learn something, and perhaps you can then stop subjecting us to things like Norco, the only medication you'll give patients in hospital in the midst of an acute vaso-occlusive crisis is oxycodone, which is basically Norco or Vicodin. Both medications contain Tylenol. 325 milligrams of Tylenol to be exact. And just to give you an idea of how dangerous this is, many years ago, the 5 milligram of Norco or Vicodin had 325 milligrams of Tylenol in each tablet. The 7.5 went up to, I think, 375 or 500 milligrams, depending on if it was Norco or Vicodin, and I guess if it was generic or not. Somebody can fact check that. And the 10 milligram tabs had 500 milligrams of Tylenol in each tablet. Today, All three of those doses contain 325 milligrams of Tylenol. Doesn't matter, because the makers know how bad Tylenol is for the body, especially a sick one. And the reason that I'm talking about this is because over the past month, I've had several patients I've advocated for whose doctors are refusing to give them anything other than Norco or Vicodin, and are totally and completely refusing to even acknowledge the danger that they're putting their patients in, all for the sake of avoiding possible addiction in the future. Like, honestly, let's understand each other. Less than 3% of the sickle cell community is in any way addicted or misusing their medications, and that percentage rate is lower than that of medical providers who get addicted to their own supply. Just saying. But I have had patients where they have not been allowed more than 5 milligrams of Norco every 6 to 8 hours, one tablet in hospital while in acute crisis. That's just cruel and unusual punishment. It's vile, it's irresponsible, and it is in no way can these doctors truly believe that they're helping anybody by doing that. I've had other patients that are on as much as 20 milligrams of Norco every 4 hours. So 325 milligrams times 4. So 12, that's 1,300 milligrams of Tylenol every 4 hours. The manufacturer for Tylenol says do not exceed 4,000 milligrams in a 24-hour period. At that rate, 20 milligrams Q4, that patient would be receiving 7,800 milligrams of Tylenol in a 24-hour period. So they are doing great amount of destruction to both that patient's liver and kidneys, and without any care or thought as to how the patient will be affected, not just on the short term, but in the long run, period. The body cannot withstand that amount of Tylenol while in acute crisis where your body is breaking down its own red blood cells faster than it can make them. And I'm making this video to plead to the doctors and hospitalists out there who are writing these insane orders with those huge amounts of Tylenol to stop and think about what you're doing. You not only have the power to give your patient better treatment, but you have access to some of the best hospitals in the world, the most like hospitals with the most medical technology, equipment, and fully stocked medications, antibiotics, you name it, y'all got it. And rather than giving patients the medications that are the safest, the quickest, and quite frankly, the best ones to use to treat their pain and to treat their problem, you are relying on an over-the-counter medication that should not be used more than 3 days in a row. It's immoral, unethical, and bordering on unlawful, and honestly, just trifling. Please Think about it. Do better.